Well, very good afternoon to you, Jane. Thanks for joining us here on the SABC.
Thank you. Thank you for having me here. My name is Sister Jane, as you've mentioned. As Rhiza Babuyile, we believe that women have to regain their autonomous right so that they can be able to manage whatever that happens with their bodies. They have a right to speak out. They have a right to decide what they need to do. All options need to be laid out to them, even especially young women. They need to know that they can do something if they fall pregnant. They need to know that they can have contraceptives. They also need to know that they can give up their babies for adoption and without feeling judged in any way. So as Rhiza Babuyile, we believe that women need to be empowered so that they can take charge of their lives.
Absolutely. And speaking about that empowerment, we've obviously seen the gendered impacts of the pandemic and the effects that have remained. And I wonder if you could speak to women's health and how important it is to address the topic of women's health during this pandemic as we navigate the waters from here into and beyond.
Okay, we've seen when the COVID-19 pandemic started, we've seen that the number of teenagers who fall pregnant is very high, and we've also seen issues of gender violence take a hype. So women needs to be given that opportunity in a way that they can feel accommodated everywhere they go with their complaints. I'm talking about rape. I'm talking about child sexual abuse. I believe that first and foremost, women themselves need to sit down and face the issues and avoid running away from them. We have to focus more on going to the school. What we've been doing as Rhiza Babuyile, we are going to schools. We've employed some community healthcare workers who goes out there to the primary from the age of to the primary schools, looking at children from the age, young girls from the ages of 12 upwards, so that these girls can now be able to address issues before they face them, especially issues of falling pregnant at an early age. So if they are given charge of their lives, they have some support groups, some support structures, including having nurses who are young enough, the young nurses who are able to identify with these women, because we don't need nurses who can now be judgmental or who these kids will be afraid to open up to.
Yeah, absolutely.
So we believe.
Yes, so Jane, you've now spoken about the high rise of teenage pregnancies that have come through, particularly, during this COVID-19 pandemic. And you've also spoken about some of the support mechanisms that are on offer, for women and young girls at this time. Another issue, though, that's come to the fore is the issue of rape. And, this is especially in young girls. I wonder if you could speak to the impact of this on young girls and women in their development going forward.
Yes, rape is something that when a woman goes through, they live with it for the rest of their lives. And it's worse when it has happened at a home environment where they were supposed to feel safe, where they were supposed to feel protected. It's done sometimes by our own fathers, by our own uncles, those who are supposed to protect us. So as women, as a mother, you're supposed to have an open mind to know that although you are having a husband that you trust in your house, something can happen, because no one knows what happens with these men when they decide to engage in such an awful act, with these children, especially their own children. So as women, as a mother, mothers need to face the truth, to always keep an open mind and know that anything can happen. You cannot just trust anyone with your girl child. You cannot just trust anyone. The girl child should approach you anytime they feel like they have to talk to you.
Well, you know, we definitely had to look at the psychosocial trauma inherited on the founding of this country, and also the patriarchal system that continues to perpetuate some of these challenges. So as we mitigate against some of these challenges, you know, I wonder what role society can play in contributing positively in raising both the young girl child, but also the male child, perhaps for a holistic, healthier future.
I believe that if our children, they are fully aware that they can go to these structures whenever they face challenges, and even amongst themselves, they can speak openly. So if we're opening a platform out there at schools where young girls have a group, they sit down and talk, and they are able to identify if one of them is having a challenge, it's gonna make a big difference. And society as well. If society was to now accept the fact that we are living in different times and in difficult times, where a lot of things are happening, where the girl or even a boy child, I'm happy you are mentioning that they are not safe at all. So you cannot trust anyone. So society should be accommodative, should design some programs that are able to welcome these young people so that they can be open about whatever experiences they face, and also to teach them so that they can see that now this person that I'm associating myself with is now posing a risk at my life. So if they are well equipped with such knowledge, we can prevent a lot of pain in future.
Yeah.
Thank you.
Well, Jane, just as we wrap up this conversation, I want to look at how important economic emancipation is at large for women going forward, but also the role of culture, norms, and tradition. How do these perpetuate some of the stigmas that we're trying to work against?
Okay, a girl child, especially in rural areas, a girl child is taught to be respectful, listen always to adults. It's not like in urban areas sometimes. There's a bit of a difference. So it poses a risk to this child in terms of whenever an adult is now abusing this child, she may not be able to speak out aloud or oppose or say no. So if we can teach our children to say no out loud, not to be afraid to say no, it will go a long way. And our women should learn to do something with their lives. I'm a woman from a rural area. I have a yard. I know that I can't depend on a man with everything that I need. I should also try. Like now it's winter time. We've had a lot of rains, so we can try to do some gardening, market our products out there. Don't depend fully on a man or on someone else. Try to be as independent as you can be. Don't depend on the grant that you get from the government. So that will help us a long way.
Well, ultimately, this boils down to equity, equality, perhaps to ensure that justice prevails. But Jane Nkosi, thank you very much for joining us. We'll leave the conversation there. Jane Nkosi is the healthcare manager for Rhiza Babuyile. It's a non-profit organization that renders healthcare services and other community development programs in many parts of the country. This came obviously on the back of today, where we mark International Day of Action for Women's Health.